I'm Gary.
Hi, I'm Cecilia.
Hi, I'm Simran.
Hi, I'm Nisha.
Hey, I'm Sherman.
As a task force of the Ministry of Health in Tunisia, we investigated the health status of Tunisia from 1990 to 2016. Through continuous research, we have collected significant data on the different variables, identifying with the well-being of the nation as a whole. After careful consideration, we have created a health strategy report to identify and help solve major public health issues.
Okay, so we're going to start it off by explaining burden of disease. Burden of disease refers to the years of life lost in an individual's life caused by premature mortality and poor health. We have gathered information on burden of disease in Tunisia in the form of DALYs, which refers to disability adjusted life years. So group 1 diseases contribute 8.92%, group 2 contributes 85.67%, and injuries contribute 10.36%.
So the top 5 causes of death in Tunisia among all ages are ischemic heart disease, cerebrovascular disease, Alzheimer's disease, chronic kidney disease, and diabetes.
The top 5 causes of death among children under the age of 5 are prematurity, congenital anomalies, birth asphyxia, acute respiratory infections, and injuries.
Three main health issues are ischemic heart disease, IHD, lower respiratory infections, LRI, and road injuries.
IHD refers to non-communicable disease in which the coronary arteries are narrowed caused by the buildup of plaque, and less blood and oxygen are able to reach the heart. IHD is closely related to diabetes, high blood pressure, and high cholesterol. Individuals with family history of IHD, an unhealthy diet, physical inactivity, and smoking behaviors should be screened for IHD. The total number of deaths caused by IHD in 2016 was 16,954.
LRI are classified as a communicable disease. Therefore, the disease is passed on between people. The easiest and most common way of catching this disease is being in the vicinity of one who has the illness while they are coughing and or sneezing. Therefore, this is the disease of the lungs.
Deaths caused by LRI have been, for the most part, constant throughout the years. In 2016, deaths were about 2,246. Therefore, we can conclude there has been no real difference in the prevention of LRI in Tunisia.
Traffic laws in Tunisia are lagging behind compared to developed countries, as enforcement continues to be an issue. The importance of seatbelts are currently disregarded by the citizens of Tunisia, which poses a problem to the safety of our citizens. The main causes of road injuries are related to seatbelt use, speeding, and helmet use. The data for the amount of road injuries in 2016 Tunisia was 2,708.
Alright, so next we're going to explain our action plan. In order to further prevent LRI, we will set out a panel of healthcare professionals who will educate and bring awareness to this disease. By doing so, our panel will begin by assessing and monitoring for LRI in schools. The panel will reach out to schools in Tunisia and provide information on this disease and care to any children suffering. Further, they will provide examples of how to prevent spreading of this disease, which will transfer over to parents.
For prevention of IHD, extensive clinical practices are needed to provide high-quality care for patients. Programs are needed to be initiated to make sure that all of the citizens of Tunisia have access to accessible and appropriate health care. Therefore, more nurses are needed to satisfy patient care in hospitals. Increasing the nursing staff can help cover most of the regions in Tunisia.
So for road injuries, the Ministry of Transport and Interior in Tunisia will have to take action and set up billboards on the side of highways and freeways to generate compliance. In addition to awareness billboards, traffic signs would have to be standardized across Tunisia, as well as ensuring that every single road has the relevant signs to guarantee the utmost safety to our citizens. So funding will mainly come from non-government organizations for IHD and LRI, and the Ministry of Transport will cover road injuries.